I would like to share with you how we are archiving and sharing the research data have resulted from the drugs and disorder project, and that have been collected in the last 4 years. Numerous data sets were collected through interviews, life history interviews, surveys, photography and observations, but also based on existing data such as satellite imagery, media resources, and other third-party data. A vast collection of information and evidence on the topics studied that has been collected. It's important to remember that often the data contains sensitive information, deal with illicit activities. The participants in the research were drug users, producers, traders, but also local communities, politicians, stakeholders, etc. Disclosure of the information can pose a risk to participants and to local researchers. Important for the project was that there was an equitable collaboration in the research with our partners in Afghanistan, Myanmar, and Colombia. The funder of the research, the Economic and Social Research Council, expects that data will be archived so they can be available for future reuse. Fortunately, they also fund the UK Data Service, a trusted data repository that has got options for providing access to sensitive data in a safeguarded and a controlled way. Safeguards we took during the research already was to make sure that ethical procedures were well developed, overseen by the Ethics and Security Panel, and that data were collected, stored and transferred, etc. in a very secure way. As much as possible, we made sure that information was being collected anonymously, so names wouldn't be noted down, but maybe codes given to people interviewed. And later on, the data were further checked for anonymization, and anonymization was enhanced as much as possible where we could. Data management also was a priority in the project. We developed a data management plan, later on a data management register. Guidance was provided to all the researchers on good data practices. Capacity building for our local partners in data practices was also important and something they really appreciated. Where interviews were done, as much as possible, these were transcribed and translated into English. And during all the data activities, the collection of information activities, we made sure that metadata was captured rigorously. So data listings of all the interviews were being made, survey forms are available, lists of questions that were asked during interviews, etc. Data preparations for archiving are still ongoing, but consist of data having been further anonymized and more detailed documentation written out. Apart from the data lists for interviews, there's also variable lists for all the survey data, and each data set has its own documentation file that provides further information on the context and methodology used to gather the data. Data will be archived as anonymous data with the UK Data Service. These will be available as safeguarded data, possibly with also permission access for the more sensitive data or the qualitative data. It's important to keep in mind that the ownership remains with the partners who collected the data. Often these are the partners in Afghanistan, Myanmar, and Colombia. And for researchers interested in using the data in future, we definitely encourage them to collaborate with our partners in those countries who originally collected the data and who continue to carry out research based on the data as well. Some examples of the data that we are getting ready for the archive and that will probably be available from the end of March onwards. Extensive questionnaire interviews in Afghanistan with key informants, transporters, traders, officials in the borderlands that were studied on the production trade and the movements of commodities, including drugs. Life history interviews that depict the social and political conditions in the borderlands and the changes that have taken place over time. Large databases of developments and investments being made in the provinces of Nangarhar, Nimruz and Badakhshan over the last 15 years. In Colombia, household surveys were done with those households participating in the national program to eradicate coca production, so the crop replacement program. And these surveys investigated the lifestyles, the changes in living standards, in income, and also people's perceptions about the program and participating in it. For Myanmar, there's extensive interviews being held in Kachin and Shan state that depict the narratives around drugs within and across communities and the effects that drugs have on livelihoods, on health, on family life, on young people's lives, etc. And also collections of spatial data that were created for each of the borderlands that include border crossings, points of interests, etc.